Adverse Childhood Experiences Study is one of the largest investigations of childhood abuse, neglect, and household challenges. It is used to determine the long-term impacts on later life health and well-being. The original study took place between the years of 1995 to 1997. Physical exams were used to find what the childhood experiences were and the current health status and behaviors of the participant. The study looks at 3 categories: childhood abuse, to include emotional, physical, and sexual abuse; neglect, that includes both physical and emotional neglect; and household challenges due to absence of parent, mental health, or violence in the home. There are different versions of the ACE study. The generic one has 10 questions, giving the participants an ACE score between 0 and 10. 2/3 of adults surveyed reported at least one ACE, and the majority of the respondents who reported had more than one. The ACE study shows how early adversity creates lasting impacts, with injury, mental and maternal health, infectious and chronic diseases, risky behaviors, and a reduction of opportunities in education, occupation, and income status. Some populations are more vulnerable to experiencing ACEs and having higher scores. And this is because of the social and economic conditions in which they live, learn, work, and play. This is addressed with social conditions, local context, generational embodiment, and historical trauma that can be seen in different ethnic groups and in different parts of the country. It's reported that the lifetime cost of non-fatal child mistreatment has incurred the United States a price tag of $401 billion. People with 6 or more ACEs have been reported to die nearly 26 years earlier than those without. With all this research and ongoing studies, you might be asking yourself, what is it that we can do to decrease the amount of adverse childhood experiences that we're seeing amongst our population? The first thing we do is we start with every child. The prevention steps can be looking at how to improve the quality of family and household environments, recognizing when occurrences happen and how to effectively address the coping devices that commonly adopted to reduce the emotional impact of these experiences, and finally, taking care of adults whose health problems are related to these adverse childhood experiences. Of course, further research and training will be needed to help medical and public health practitioners understand how social, emotional, and medical problems are linked throughout the lifespan, as stated in the American Journal of Preventive Medicine. Increased awareness of the frequency and long-term consequences of adverse childhood experiences also can lead to improvements in health promotion and disease prevention programs. For more information about the ACE study or to take the ACE assessment yourself, please visit stopabusecampaign.org or cdc.gov. We hope the information that you received in this video has increased your knowledge about the ACE study and has given you the opportunity to learn how to enhance your prevention programs and learn how we all together can work to decrease the impacts of adverse childhood experiences.